Do you ever wonder what happens on the day of surgery, before, during, and after an operation? My name is Dawn Rodriguez. I'm a nurse practitioner and also the aesthetic director at STARS Plastic Surgery in San Antonio, Texas. Whether you have already scheduled an operation with us or if you're just getting more educated about this process, I'm going to go over with you what to expect on the day of your surgery and highlight some key areas of how we might make this experience enjoyable and comfortable while keeping your safety as our #1 priority. If you're watching this video and have an upcoming operation scheduled with us, be sure to watch our video on how to prepare for surgery, where Dr. Chan, one of our surgeons, goes over some key information about medications and what to do and what not to do before your surgery. The STARS Plastic Surgery Facility is accredited by the American Association for Accreditation of Ambulatory Surgery Facilities, or QUAD-ASF as we call it, and has been around since 1980 and widely considered to be the gold standard in accreditation. Our surgery facility is located just adjacent to the Methodist Specialty and Transplant Hospital with the breezeway that connects us. This is important because we are able to offer you a private, personal, and comfortable environment for surgery while being steps away from the most advanced technologies in medicine. As you walk through the door on the morning of your operation, you will see Melanie. Melanie is your pre-surgical coordinator who has been working with you to make sure that all of your lab tests and pre-operative evaluation is not only complete, but readily available to your doctors. A urine sample will be requested from you if you are female. She will then bring you into a private room where you can change out of your clothes and into a robe. A blanket is waiting for you fresh out of the warmer in case you need it. And there's no need to worry about bringing a bag to bring your clothes into, as we have one waiting for you that's for you to keep. There are several people you'll have to see. First is your surgeon. He or she will visit with you and review the surgical plan, answer any last-minute questions, make the markings on your body, and take photographs of those marks. You will then meet with one of our nurses, Debbie, Jana, and sometimes myself. We will take your blood pressure, temperature, vital signs, and start an IV. Your anesthesiologist will chat with you and go over what to expect with general anesthesia. We only work with a small hand-picked number of anesthesiologists, and they are very accustomed to anesthesia for outpatient cosmetic surgery. If you have had general anesthesia in the past, whether you have had a good experience or a bad experience, this is the time to let him or her know. Before we bring you back to the operating room, of course, we have to have the proper consent forms. You will say bye to the companion who brought you that morning. He or she will be able to stay in the waiting area where refreshments are provided, or they may also enjoy one of the nearby cafes. We typically recommend that they bring a good book or have some work to do because most operations take at least 2 to 3 hours between the surgery and recovery. We will also give them periodic updates while you are sleeping. Now, this is where the magic happens, in my opinion. We will first comfortably position you on the operating room table and put on a soft belt so you feel snugly underneath some warm blankets. We actually have a warmer called a bear hugger to keep you nice and warm during surgery. As we have learned, keeping your body temperature constant is actually very important to make sure your body heals properly. As you go off to sleep, you may remember some soothing music, putting on monitoring pads, and a blood pressure cuff. That's actually about most of what you'll remember. As you fall asleep, you wrap squeezers around your legs to keep your circulation moving, and we also make sure that all your bony areas of your body are properly padded, like the heels, the elbows, and the back of your head. I know I'm going into what seems like really small details, but in my opinion, these details are what differentiates a good cosmetic operation from a great one. There is so much behind the scenes that happens to get the operating room ready, which I won't go highly into, but I highly recommend watching our surgical director, Wendell, explain the details of maintaining our surgical instruments to strict standards of our surgeons. The next thing that you'll remember will be in our recovery room. Most of your patients spend about an hour or so in the recovery area. Some patients have a little pain, or nausea, but we are really good at controlling that with the right medications. If you're particularly prone to post-operative nausea and vomiting, let us know before surgery because we have a really good regimen of medications for that. Your surgeon and anesthesiologist will come check on you while you are waking up, but most people may not remember. Our nurses will go over the post-operative instructions with you, but don't worry if you don't remember because we will have that on paper as well as on video. And as you leave the facility in a wheelchair, we will remove your IV. You will have a phone number to call in case you have any questions overnight, and we will call you the next morning. I hope you find this video helpful in your surgical journey with us. As you see, there are lots of parts to ensuring success of your operation, which is what we do best here at Stars Plastic Surgery. This preparation starts weeks before your operation, from coordinating your preoperative tests to making sure that the right implants, medications, instruments are there on the day of your surgery, to the individual preparations that is needed not only from your surgeons, but the surgical assistants, anesthesiologists, surgical technicians, and of course, the nurses. Thank you for watching and choosing Stars Plastic Surgery. If you like this video, give us a thumbs up and ideas of what other topics you'd like to hear about.